Another crowded rally at the state capitol, concerned citizens asking lawmakers for more cash for their cause. We've heard a lot of no's, but this time it's a yes.
People from around the world come to Texas for cancer care. Why not for mental health?
Lawmakers in the Texas House say they're prepared to spend millions of dollars more this session for mental health. But is that enough to really impact the crisis?
A new state report says 1 in 5 Texas children has some form of mental disorder. KXAN's Phil Prazen takes an in-depth look at one idea to help identify and treat those children before their issues become a more serious problem.
As a pediatrician, Ryan Van Ramshorst is required to give one mental health screening to his patients between 12 and 18 years old. Tax dollars pay for it through Medicaid. But one time might not be enough.
Where a child might come in for a cold, but it later comes out during that visit that they're having symptoms of depression. That pediatrician is going to address that depression or schedule a follow-up visit to delve more into it.
Lawmakers are now trying to require and pay for a screening every year.
Setting children and families up for success.
This session, the state budget is tight. The word is out that if a program or department keeps the money it has, it will be a victory. That's why Chair of the House Select Committee on Mental Health is happy the proposed House budget has more than a $150 million increase to mental health purposes.
Most mental illness will manifest at a young age, and if treated early and intensely, that is where the greatest chance of success actually lies.
Now he'll try and convince his colleagues that paying for more regular mental health screenings through Medicaid will save the state money in the long run by keeping people out of jail and state hospitals.
A limited, behavioral health screening or check at an early age probably isn't sufficient.
He's the joint author of the bipartisan bill, and he'll be working this session to pass it. Phil Prazen, KXAN News.
Texas is experiencing a shortage of psychiatrists. A 2015 survey found that 185 of the 254 counties in Texas do not have any psychiatrists. Just over a week ago, Republican State Senator Charles Schwertner from Georgetown filed a bill to make it easier for psychiatrists licensed in other states to work here. Texas is one of 8 states without reciprocal licensing.